All right, let's be real for a second. Medical terminology can look incredibly intimidating, right? I mean, it literally looks like a completely alien language designed just to trip us up. But what if I told you that you already have the key to unlock every single one of these massive, complicated words? Well, you do. In today's explainer, we are absolutely decoding the terminology of the female reproductive system. We're going to break it down, sound it out, and completely master it together. Let's dive right into this. So here is the ultimate secret to our entire mission today. Word parts are literally just parts of a puzzle. Every giant, terrifying medical term you come across is really just a collection of small puzzle pieces. You've got a prefix at the start, a root right there in the middle, and a suffix snapped onto the end. They're just waiting to be put together. Honestly, once you know what the individual pieces actually mean, you can decode absolutely anything they throw at you. We're going to map this whole thing out across 5 levels today: inflammations and conditions, surgical removals, flows and discharges, diagnostic and surgical procedures, and natural reproductive processes. Let's go.
Okay, level 1, inflammations and conditions.
Now, this is brilliant because it perfectly illustrates our first major linguistic contrast. On the left side, we've got vaginitis. Go ahead and say it with me. Vag-in-itis. That itis suffix specifically means an active inflammation. So boom, inflammation of the vagina. Simple. But look over to the right. We have endometriosis. Let's sound that one out. Endometriosis. You see, the suffix osis totally shifts the meaning. It means an abnormal condition or a disease process. So in this case, it's an abnormal condition of the endometrium, which is your uterine lining. Both are definitely problems, but our puzzle pieces tell us exactly what kind of problem we're dealing with. Let's do a quick rapid-fire round to apply this itis puzzle piece to our reproductive anatomy map, just to lock it perfectly into memory. First up, cervicitis, inflammation of the cervix. Next, cystitis, inflammation of the bladder. And finally, endometritis, inflammation of the uterine lining. Notice how the root changes the location, but that itis suffix keeps the underlying meaning exactly the same. Boom, boom, boom. You're already translating the stuff. Building right on that, we have mastitis. We take the prefix masto/o, which means breast, and we snap it right onto itis. So mastitis is simply inflammation of the breast tissue. When you look at the diffuse swelling and the multiple nodules happening here, you can visually anchor that linguistic prefix to the physical structure. It makes the term practically impossible to forget. So, the crucial point I want to make here is that not every single infection gets the itis treatment. Take vaginosis. That's pronounced vaginosis. We have the root vagino snapped together with the suffix osis, which, if you remember from a minute ago, means an abnormal condition. It's an abnormal bacterial condition of the vagina, sure, but without that specific active inflammatory response that the itis suffix demands. See how incredibly exact this language is? All right, moving on to level 2, surgical removals. Okay, grab your next crucial puzzle piece. The suffix here is ectomy, pronounced ec2-my. It literally means to surgically cut out or completely remove a specified anatomical part. The cool thing is, once you memorize this one single piece of the puzzle, you instantly understand dozens of major surgical procedures. So let's start applying it. Let's break down these pelvic removals, making sure we split the syllables perfectly. First, salpingectomy. Salpingo refers to the fallopian tube, so a salpingectomy is the removal of the fallopian tubes. Makes sense, right? Next up, oophorectomy. Oophro means ovary, so oophorectomy is a surgical removal of the ovaries. And lastly, a super common one you've probably heard, hysterectomy. Hystero refers to the uterus, making a hysterectomy the complete removal of the uterus. Moving superiorly up to the breast tissue, we just apply our esectomy suffix again. We have mastectomy, taking that masto root we learned earlier to mean the surgical removal of the entire breast. And just below that, lumpectomy, which is the highly targeted surgical removal of a lump or a tumor. And hey, note the Canadian spelling of tumor there with an U, just a fun little detail to keep in mind. Let's step up to level 3. Flows and discharges. Here is your brand new core puzzle piece, RIA. Let's establish that exact pronunciation right now before we do anything else. RIA. It's a suffix that simply means a flow or a discharge. Let's lock that firmly into our brains right now before we start attaching it to different prefixes. RIA equals flow. Got it? Now let's assemble the actual words. First up, amenorrhea. The prefix a means without, so amenorrhea is the absence of a menstrual flow. Next, dysmenorrhea. Dys means difficult or painful, which gives us difficult or painful menstrual flow. And finally, check out galactorrhea. Galactose/O is the root for milk, so galactorrhea is an abnormal milky discharge that isn't associated with normal nursing. Seriously, once you know rhea, you practically own all of these words. All right, level 4, diagnostic and surgical procedures. Now, this is a really fantastic comparison for understanding procedure suffixes. Over on the left, we've got laparotomy. The suffix otomy means to make a surgical incision. So a laparotomy is simply an incision into the abdomen. But contrast that with the word on the right, colposcopy. The suffix scopy means a visual examination, usually done with some kind of lighted instrument. Colpo means vagina. So a colposcopy is a visual examination of the vagina and cervix. Incision on the left versus visual examination on the right. And just to cement that clinical reality in your memory, this shows you exactly what a colposcopy looks like functionally in the real world. You can clearly see the speculum opening the vaginal canal and a swab being applied directly to the cervix under visual examination. When you read the word colposcopy, this specific physical action is the exact reality your brain should picture. Okay, I need everyone to take a deep breath. We have officially reached the final boss of surgical terminology. It is massive, but honestly, we aren't scared because we know it's literally just a bunch of puzzle pieces. Let's sound this out with absolute triumphant energy. Salpin gostami. Yes! Let's do it one more time. Salpin gostami. It's just combining salpingo, meaning tube, with salpingo, again, meaning tube, and stomy, which means creating an opening or connection. Put it together, and it literally just means a surgical procedure to connect two previously separated segments of a fallopian tube. See? You just defeated the final boss word. No sweat. And finally, level 5, natural reproductive processes. So here is the chronological journey of the human reproductive life cycle. We generally start around day 14 of a cycle with ovulation. That's the release of the ovum. Moving right along to day 15, we have the potential for fertilization, which is when the ovum and sperm actually meet. If that doesn't happen, around day 28, we experience menses, the shedding of the uterine lining. And then, if we fast forward on the macro timeline to age 50 plus, the cycle concludes with menopause, the permanent cessation of menses. 4 foundational processes, all deeply connected by biology. Let's wrap up our entire deep dive today by flawlessly pronouncing 3 structural terms that describe these anatomical regions. First up, ovarian, simply meaning pertaining to the ovaries. Second, fibrocystic, an adjective describing something composed of fibrous and cystic tissue, which is often used to describe natural changes in breast tissue. And finally, myometrium. Myo means muscle, and metro means uterus. So the myometrium is the thick muscle layer of the uterus itself. And with that, you've completely secured the ultimate vocabulary victory. You know, we started this explainer staring at a wall of intimidating, impossible-looking words. But by breaking them down and just snapping the puzzle pieces together, we've completely decoded the female reproductive system today. You literally hold the power of medical language in your hands now. It's just a puzzle. So I leave you with this. What medical terms will you decode next?